Hello YouTube, I'm Dr. Fox. Today I'm going to talk about warning signs of health problems after giving birth. Okay, key points are certain levels of discomfort after pregnancy is to be expected. However, new mothers need to be aware of numerous risks that require medical interventions. 2. Being informed on how to spot healthcare issues can save lives, with all conditions easier to treat if spotted and acted on quickly. 3. Being vigilant can allow mothers to avoid very serious and life-threatening health complications, which can result from infections, blood clots, postpartum depression, and postpartum hemorrhage. 4. Symptoms to stay alert for include respiratory issues, chest pain, severe migraines, heavy breathing, and extreme pain. Last, there is a risk you are experiencing one of these severe complications. Contact a doctor immediately. Okay, first of all, when is medical care required after pregnancy? Numerous physical changes occur as a result of pregnancy, meaning a healing period is required. Feeling some aches and pains during the weeks after pregnancy is to be expected, while sensitivity will also come with fatigue. However, in some cases, mothers can become susceptible to life-threatening issues, so this is a time to be vigilant and consult with a medical professional if you have any doubts. Be sure to contact emergency services if you have any impression that your life is at risk. Postpartum care is a necessity for all mothers, and you should attend any postpartum appointments, even if you think everything is absolutely okay. There is a reason that postpartum recovery consultations are in place, as all mothers should make completely sure rather than assuming they have recovered from the trial of labor and birth. These appointments allow professionals to safeguard you from any common issues mothers can encounter, as the days and weeks after birth can prove complicated, including serious risks to a mother's health and even prove a threat to life. Even in our modern world, mothers die because they have failed to be safeguarded against conditions that a doctor could have prevented. As of risks to look out for after pregnancy, typical complaints that can prove to be signs of severe health complications can include respiratory problems, chest pain, heavily bleeding, or extreme pain. Should any of these affect you, make sure you consult a healthcare professional immediately. If you feel the situation is life-threatening, call 119 in Japan to contact the emergency department. Indications of complications include signs that another person might spot, such as rash or if you have coughing fits. However, there will be many symptoms that only you can act upon, like dizziness or a sore throat. Contact your healthcare professionals if any indication of the following symptoms occurs. Okay, first of all, infection signs and symptoms. Fever greater than 38 degrees Celsius. This is a sign that your body is acting to destroy the bacteria causing an infection or a virus. 2. Discharge, pain or redness that persists or worsens, related to a caesarean section cut, episiotomy or perineal tear. Also known as cesarean birth, a C-section is when a complication means that a surgeon has to make an opening in your belly and uterus or womb. Other complications during birth might mean an episiotomy, which is a cut at the vaginal opening to ease the baby's passage. Additionally, some women can experience a perineal tear, which can occur naturally during vaginal birth, tearing the skin between the vagina and rectum. 3. Painful sensations or burning during irritation, needing to irritate too often, and pain in the lower back or side. These symptoms may mean a UTI or urinary tract infection, which is similar to cystitis or a bladder infection, or pyelonephritis, a kidney infection, and will require antibiotics. 4. Red patches or lumps on your breast that are unusual and painful. This could be mastitis or a breast infection. causes for this can include a plugged duct, breast becoming swollen due to too much milk, or if you have missed your typical breastfeeding schedule. 5. The lower belly experiencing significant pain, which could be endometritis, an inflammation to the uterus lining. Last, vaginal discharge releasing an undesirable odor. This could mean endometritis or also bacterial vaginosis, which is an infection caused if a particular bacteria is present at too high a level. Occasionally, people can experience a severe reaction to infection known as sepsis. This will lead to fatality if left untreated and requires an emergency response. Be sure to look out for any of the following during the days and weeks after pregnancy: a belly cold or chilly sensation, clammy or sweaty skin, quickened breathing or quickened heart rate, a sense of confusion, fever, suffering discomfort, or extreme pain. Okay, other health complications to look out for. 1. More significant bleeding than you would expect from a typical period, as well as bleeding that appears to get more extreme. This could be the result of PPH or postpartum hemorrhage. This condition develops due to heavy bleeding post-pregnancy. It is not a common condition, but mothers will need to be assessed for it up to 6 weeks after giving birth, as it can be life-threatening. 2. Warm or tender legs, including swelling, pain, or signs of rash, particularly in the calf areas. These are symptoms of DVT or deep vein thrombosis, which tends to result from the formation of a blood clot in the thigh or lower leg. 3. Your eyesight being affected, which can include headache, symptoms, dizziness, or discomfort in the upper right belly or shoulder, respiratory difficulties, surprising weight gain or leg, hands, or face swelling. These can all be signs of postpartum preeclampsia, which result from high blood pressure and comes with the added complications that bodily organs like the liver and kidneys might have their performance affected. This needs to be treated as an emergency. 4. Chest pain, gasping, or coughing can be signs of PE or a pulmonary embolism. This emergency situation is what transpires when a blood clot has formed in one part of your body and transfers to a lung. 5. Emotional fatigue or being overly disheartened, especially if lasting for more than 10 days after pregnancy, as this can mean PPD or postpartum depression. PPD is acknowledged as a particular depression that can affect women after giving birth and includes feelings of sorrow, apprehension, and lethargy that can persist over long periods. Being in such a state makes it challenging for mothers to live up to their role and bond with their children. It can be treated but should not be ignored just because its symptoms are not physical. Okay, last. Sickness sensations, or actually vomiting, may mean that cardiovascular disease is occurring, also known as heart disease or PPH. Being diagnosed with cardiovascular disease means that the heart and blood vessels are being challenged, which can include the heart muscle itself and lead to the risk of stroke due to blocked or narrowed blood vessels. Okay, thank you for watching. See you soon.